So good afternoon, everybody. My name is Lynne Short, and I'm the Vice President of Kitchener-Waterloo Community Foundation. Kitchener-Waterloo Community Foundation is committed to convening conversations that lead individuals and organizations to actions in our community. Today's Do More Good dialogue is focused on the state of oral health in Waterloo Region. We've enabled closed captioning features for this event, so if you click on the live transcript button at the bottom of your screen, you can select to show or hide the subtitles. Before we begin, I would like to respectfully acknowledge that KWCF serves a region that is located within the land that is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. This territory is within the lands protected by the Dish with One Spoon Wampum. We acknowledge the enduring presence, knowledges, and philosophies of the Indigenous people with whom we share this land today, their achievements and their contributions to our community. We offer this acknowledgement as an act of reconciliation between Indigenous and non-Indigenous peoples of Canada. So when I prepare for any meeting, I think about this acknowledgement and what I'm doing personally to support the actions through the Truth and Reconciliation Commission, because for me, it's a continuous learning process and a continuous acting process. So this week, I had the opportunity to talk and learn from two amazing Indigenous elders who helped guide me in an approach to create the space for local Indigenous-led organizations to do the work they're doing in support of Indigenous people. And it's an approach that KWCF is going to try with some new work that we're doing. And I'm committed to following their advice and thought I'd share that as an example of something that I'm doing towards this work. And then now let's move into talking about oral health in Waterloo Region. I am really excited to have Steve Ayer join us to present a snapshot of a report he's created looking at research and data related to oral health in Waterloo Region. This work is being supported by Green Shield Canada as part of their Community Foundation partnership strategy. And we are so lucky to have Green Shield Canada supporting Waterloo Region in many of our initiatives in the space of mental and oral health. We're joined here today by a few members of the Green Shield Canada team, and I asked Brett Clapperton to say a few words to help you understand why they're supporting this work. So Brett, if you could just say a few words.
Yeah, thank you, Lynne. That was a great introduction. So for anyone who isn't familiar with GSC or Green Shield, we're a health benefits provider that serves communities across Canada. And really the heart of what we do is making it easier for people to live their healthiest lives. So, with all of the change that we're seeing in the healthcare system and digital mental health, our mandate is continuously expanding. But the thing that stays really consistent is our social impact mission at the core of that. So again, for anyone who doesn't know, GSC is actually a social enterprise. So everything we do is done with the goal of, supporting our communities and making sure that this all is in service of healthier communities. So through that, we identified two areas where we felt that, not only could we make the biggest difference, but we're really underserved. And those areas were mental and oral health. So we, as Lynne mentioned, have partnered with community foundations across Canada, including our friends here at Kitchener-Waterloo, to really focus on how we can advance oral and mental health granting within communities, as well as look at things from a systems level and a knowledge sharing approach where we can say, how can we make a real difference in the way that we think about oral health? So, if anyone who's working in this area, I think, is very familiar with the fact that oral health is not always kind of a community priority, and it can kind of be in its own little silo. So when we came up with the idea for these reports, which we're kind of calling oral health scans, it was, how can we work with community foundations and kind of follow their leadership in translating all of these issues around oral health to demonstrate how they really impact communities. So we've partnered with Kitchener-Waterloo, who are we'll call them pioneers or maybe guinea pigs, in the sense that this is the first one that's been done. So thank you again for your bravery there and taking the lead, but there are also some pilots underway with Toronto and Ottawa. And the hope is that, we'll be able to create a really meaningful picture of what oral health looks like in each community, and then see also how we can learn from each other as these reports continue to develop. So thank you all for your participation, for those of you who contributed, and hopefully this is the start of some change or some new ways of sharing information about oral health. So I'll turn it back over to Lynne, but thank you so much, and thanks again for having us.
Thanks, Brett. Okay, so I'm just going to take a moment to introduce Steve Ayer to you, who's going to spend the next about 25 minutes walking you through some of the research finding. Steve is the CEO of Common Good Strategies, a social impact research firm based in Waterloo Region. So we're really lucky he moved into the region recently. He's a social strategist, data scientist, and public speaker. Combining his extensive management and social impact expertise, Steve leads projects that bring a wealth of knowledge and networks to clients seeking to catalyze strategy for inclusion, philanthropy, CSR, and nonprofit innovation. He's a recognizable analyst and a voice on the not-for-profit sector and social issues, including affordable housing, food security, growing inequality, and precarious work. Steve currently serves as the lead researcher and author of the Toronto Foundation Vital Signs report and the Imagine Canada Corporate Community Investment stream of research. He's worked with numerous national, provincial, and regional social purpose organizations. He's also leading KWCF's 2021 Vital Signs report that's focused on affordable housing. We're launching that October 7th, just to put in a plug in case you want to and haven't registered. And in fact, this oral health report is one of the data inputs to KWCF's Vital Signs report. And we thank Green Shield Canada for allowing us to include that as a lens into this work. And so we have the benefit of his expertise on these two interconnected projects. And it's been invaluable around the affordable housing area and other issues in the community. So Steve, I'm going to turn it over to you and turn off my camera and audio, and Brett, you can do the same for now, and we can hear about the report.
Okay, great. So I'm going to talk a little bit about the research we've been doing, KWCF and Green Shield Canada have been working on. We titled the research report Left Behind, the State of Oral Health in Waterloo Region. So the report itself focuses on what data we could find on oral health in the region. And it's unsurprising to, I'm sure, everyone in the room, that there are a number of folks who have not been properly served by the system. So we're going to go through some of the data that we have about those who are struggling in terms of their oral health and getting access to dental services, as well as some of the groups that are doing better, and try to provide that in the context of how the overall region has been changing. Lynne's been talking about the affordable housing piece. We also see in the pandemic, we've seen drastic surges in food insecurity in the community. We see unemployment rising. So we want to put that together in sort of a picture of how some of the older data we have on oral health intersects with some of the changes we've seen over the last decade in the region. And then also how it's been intersecting with some of the changes coming with COVID. For the study, we relied on the Canadian Community Health Survey extensively. So Canadian Community Health Survey is a study that the government, Statistics Canada, undertakes, where they survey more than 100,000 Canadians across the country, including 1,200 responses in the region of Waterloo. So they ask people detailed questions about their oral health, whether they have access to benefits, and whether they're avoiding the dentist due to the cost of the services. And it covers Canadians over the age of 12. So we have a pretty decent sample there that allows us to explore some of the differences in terms of who has access to oral health, who might be dental services, who is struggling with their oral health. At the same time, as there are certain limitations. Typically, these surveys really do struggle to reach the most marginalized. Very rarely do we have a large sample of people who might be homeless, the most precariously housed. It's very difficult to survey them. So a lot of the data we have is really valuable and provides some critical nuance, but it doesn't always do the best job necessarily at really diving deeply into those most needs. So that's something to keep in mind, even as we're going through a lot of these stats. In particular, there was not a large sample of Indigenous people in the sample. So it's really hard to sort of provide some insights that we would love to have on how Indigenous people in the region are doing. But unfortunately, based on sample size, there's certain things that we'd love to look at, but we just couldn't based on how many people responded. And the last piece is a number of different points in the survey, we make comparisons to 2005. So we want to look at how some of the indicators that we measure are changing over time. The survey did change its methodology, so it's important to keep in mind that while we're providing some really valuable context and nuance, some of the things should be interpreted with a little bit of caution, just because survey methodologies do change, and it does sometimes inhibit us to make the comparisons that we'd like to. And I note anytime in this presentation where that's something you should keep in mind. So first off, in terms of what the survey tells us in the most recent year, which is the 2017-2018 version, there was 138,000 people in the region who did not have dental insurance or access to any sort of support for dentists for dental services. That's an increase of 30,000 from 2005. 104,000 people said they avoided going to the dentist due to the cost of services in the previous 12 months. 54,000 residents said the only time they go to the dentist is for emergency care. Another 46,000 said they're feeling persistent pain in their mouths, and 25,000 reported dissatisfaction with appearance of their teeth or dentures. So just a high level, and again, I'm sure this isn't a surprise to many of the folks working on this, but this is a pretty significant challenge in the region. So one of the things we did is try to compare and see how is Waterloo Region doing to other health units and public health groups in Ontario. So the chart on the left shows the rates of how many people have dental insurance. The chart on the right shows the percentage of people who self-perceive their oral health as excellent or very good. In both cases, the region of Waterloo public health is in light blue. The province average, including all health units, is in orange, and the rest of the data points are in dark blue. So in both cases, in terms of the rates of dental insurance and the rates of people perceiving their oral health as excellent or very good, Waterloo was very, very slightly above average for the province. It wasn't like a dramatic difference in either case. So 70% of people reported they have dental insurance versus 67% across the province. 62% said their oral health was excellent compared to 61%. So you can see here, like there's definitely a whole bunch with higher rates and a whole bunch with lower rates. Where we do see some pretty significant differences is once we start breaking that out. When we just look at the distribution of income. So this chart here shows what percentage of people reported they had access to what they were without dental insurance based on income distribution. So income distribution was split to 10 different buckets with decile 1, those are the bottom 10%, those with the lowest income. Decile 10 is the top 10%, those with the highest income. And this looks at the percentage of folks in each of these sorts of categories who report they have access to dental insurance, whether it's through the government or through their employer. And you can see the bottom 40% have much lower rates of dental insurance, with the highest rates of inadequate services or lack of access to insurance amongst those in the 20th to 30th percentile of income. But broadly speaking, there's a clear gap in terms of all of those in the bottom 40% have lower access to dental insurance than anyone in the top 60%. And there's really very little variance. Once you sort of get to that top 60%, it's hard to predict how likely someone is to have dental insurance in that sort of category, as long as they're sort of getting to those. I mean, typically they're coming with full-time jobs and they're getting their insurance through those full-time jobs. Those at the bottom are typically those who without full-time jobs, often getting their benefits through social services, government programs, things like that. And again, I'm sure this doesn't come to a surprise to anyone on this call, but those without insurance are far more likely to not be going to the dentist an adequate number of times. So people without insurance were 4 times more likely to say that they've avoided the dentist due to cost in the previous 12 months. They're also 4 times as likely to say that they never go to the dentist or they only go for emergency purposes. Obviously, preventative care can have huge impacts. So we often see here is those without insurance. They're often the ones saying that they need to go the most, but at least likely to actually go, and the barrier is cost. And again, perhaps not a surprise to many, but one of the challenges for low-income folks in Canada is just how low the investment is in oral health across the country. This chart here is a bit older because we didn't have recently updated data, but the most recent data we could find was for 2013, which compares the spending percentage of dental spending from public sources for a variety of OECD countries. And you can see by far Canada had the lowest public expenditures on dental care. The United States was also relatively low, but you can see that the typical country is spending about 6 times more on 5 to 6 times more on dental services from public sources as we do in Canada. And then when we dive it more deeply into Ontario, this chart from 2017 shows the actual spending in Ontario was only public dental care expenditure in Canada was only $6 in Ontario. That's per capita. And so much lower than the overall rate for Ontario, much lower than the overall rate for Canada, and the lowest of any of the provinces. So for those who don't have insurance through their employers, which is typically how this system is served in Canada, there's very little investment either in Canada or in Ontario. So in both cases, we can see that there's really low relative investment, which is why there's so few programs to support those who don't have the benefits through their workplace. It was also noteworthy that the chart was developed before the new seniors dental program was introduced in Canada. Though of the 2.5 million seniors in the province, about 50,000 had enrolled as of the most recent data that I could find. So while this would have increased slightly, it's a relatively small increase in people using that program. So it wouldn't be sufficient to even get Ontario up to the next lowest province in terms of per capita expenditures. Breaking this out, this is something that we talk about in our chart, but in the report that'll be upcoming, but was not actually there. I did want to dive into a little bit of why people in the third decile of income had the lowest rates of dental insurance, because especially it is so strongly correlated with not going to the dentist. So people in the brownish, I should have picked an easier to describe color, the brownish gray color there, is the percentage of folks who have dental insurance through their employer. The green color there shows the percentage of people who have it through any other type of program. So predominantly for the lower income folks, that's through government social services programs, children's insurance programs, etc. So you can see that 43% of those in the lowest decile of household income get access to dental coverage through other programs, which typically are again, government programs. Only 17% in the bottom 10% of income get it through their employer. When you get up to the third decile, decile 3, 37% of people have insurance coverage through their employer, and only 4% through other types, which again, that level of income is typically social services oriented programs. So this is why those in the decile 2 and decile 3 are really struggling in many cases with access, because their income is too high to be eligible for a lot of the programs, but really too low, and their jobs tend to be more precarious and be ones without benefits. They're sort of stuck in a challenging spot. They make too much income to be able to afford to be able to use the services that are available through government programs. But really, I mean, in many cases, they're saying they can't afford to use the dentist, and they're really kind of stuck in this very challenging situation where their income is still not adequate. A lot of these factors get much more complicated when we look at the trends and the cost of dental care services over time. This chart here shows every major subcategory of inflation, excluding tobacco, and how it's evolved over the last 20 years. The bar at the top is healthcare for dental care services. And you can see, compared to every major subcategory of goods and services covered by the Consumer Price Index, which measures inflation, dental care services has been increased as much as nearly any other sorts of services. Overall, inflation over the last 20 years has been 41%. Dental care services have increased by 81%. So when we look at those low income folks who are reporting struggling, see, over time it's gotten harder and harder because as the services have got more expensive, their income have not corresponded, and we're creating larger gaps in terms of those who are looking to get these sorts of services. Another thing I want to talk about is the situation with precarious work in oral health in Waterloo Region. So there's also some evolving trends here that are really critical to go through and highlight how that's affecting some of the challenges that for the lower income folks in particular in Waterloo Region. So this chart here, and there's a lot on the slide, so I'll walk you through piece by piece. But the chart here shows in the light blue data from 2005, and in the green shows data from 2017, 2018. I did want to note again, like there are some caveats because the survey methodology has changed over time, so that you really want to interpret these differences with caution. But I think some of the trends we're going to talk about for the next few slides are really important because they're illustrative, even though we should interpret with a little bit of caution. So in 2005, 28% of people in Waterloo Region said that they did not have dental insurance. By 2017, 2018, that increased only slightly to 30%. But we see a slightly larger increase in the percentage of people who say that they didn't have employer-sponsored insurance, which increased from 36% to 40%. And the reason that the overall rates of of people without insurance didn't increase more is there was this expanded rollout of various government programs to support people with for insurance purposes or providing dental insurance through government programs. Where this gets particularly challenging is when we start breaking this out again by income. So again, the colors in the chart here show the same patterns. 2005 is in light blue, 2017, 2018 is in green. So when we look at full-time workers in the bottom 40% of household income, the odds that 27% of them said that they didn't have access to employer-sponsored dental insurance in 2005, where that number had increased to 42% in 2017, 2018. When we look again at that top 60% of workers, we really see very little difference in the percentage of folks who reported they had access to dental insurance. But it really kind of these combining trends really speak to where we're having some really severe and emerging issues in oral health. Because the people who without access, the lower income folks who are not eligible for a lot of the public benefits, they're working full time, but they're not getting benefits through work. And that rate in particular is the only one we really see drastically changing over time. For those workers who are compensated more, there's really no real increase to there's no real trend we're seeing in terms of people having less access to benefits. But for lower income full-time workers, we start to see some more significant differences. And this connects to a trend we see over the last little while in Kitchener, Waterloo, Cambridge. So from 2006 to 2019, when we look at full-time employees, the overall number of full-time employees increased 17% over that time frame, so about 14 years. So 17% increase in full-time employees. But the types of jobs that were growing fastest were all ones that are less likely to have insurance and access to dental care services as part of an employment package. So part-time employment grew at almost twice the rate of full-time employees. Self-employment grew at 2.5 times the rate of full-time employment, and temporary employment grew at almost 3 times the rate of full-time employment. And so each of these sorts of trends is self-employed individuals, like more than half of them do not get access to dental care services through work. And these are the jobs that we're seeing expand across the country, but they're growing even faster in Waterloo Region than the rest of the country, which is really bringing the region to the forefront of the growing issues of precarity amongst the lower income workers who often do not have these sorts of benefits. And it's not just oral health, it's often also a variety of things like pharmaceutical coverage, retirement plans, training programs. A whole variety of things come with these sorts of jobs that are temporary, self-employed, or part-time, because the employers typically are not making the same investment in their employees as they do in others. And these jobs are particularly concentrated in younger, racialized, lower income, and other marginalized communities. These are all sorts of just a variety of a selection of things that people who are in precarious jobs and temporary jobs, part-time jobs, all these sorts are less likely to have, ranging. And it's the combination of all of these things combined with that growing cost of the service that really speaks to why there's so many challenges. And then in Waterloo Region in particular, like much of the country, there is a huge issue with growing housing affordability problems. When we look at the price of a vacant apartment in Kitchener and Waterloo, Cambridge from 2008 to 2020. A bachelor apartment in 2008 cost $489 per month. By 2020, that increased to $1,089, 122% increase in just a 12 or 13-year period. The income data that we have is basically income's growing at about 1% faster than inflation. The cost of rent for vacant apartments is growing at 7 or 8 times faster than inflation over the last little bit. And even before this very, very rapid increase in housing prices, we already saw that renters were really particularly likely to struggle. So 29% of renters aged 30 to 59 had no dental coverage versus 15.5% of owners in the same age category. And that corresponded to, of course, lower oral health, less likelihood to visit the dentist. And a lot of this was people who are living in units that were cheaper. People who are renting in these current units are going to have these issues at much, much higher rates than people who rented a decade ago and have been in rent-controlled apartments since then. Traditionally, homeowners have not been a particular challenge in terms of they've had relatively good access to dental care services and relatively low rates of saying that they couldn't afford it, the dental care services when they need it. But we are starting to see some really challenging trends in the Waterloo region with rapidly exploding home prices that will very likely contribute to greater numbers of challenges for the homeowners in the future. So, I mean, in 2005, the typical home price in Waterloo Region was $205,000. By 2021, it was $749,000. So home was about 3 times income back in 2005. Now it's 8.6 times higher than income. And while inflation rates have decreased, it's nowhere near as much as the rate of how much the price of the homes have increased. So really, it will increase challenges for those who are homeowners, and particularly first-time homeowners. They're more likely to have difficulty accessing affordable housing, oral health services in the future because they've put so much of their income towards purchasing a first home. Oh, again, one of the things I mentioned at the beginning of this is that we lack good data on certain areas. And one of the most critical ones is the most precariously housed. The survey really only differentiates between renters and owners. And I think some evidence from Toronto really highlights just how challenging some of how significant the challenges are for some of the most marginalized. A study in Toronto's shelter system found that 97% of those surveyed in the shelters needed dental treatment, 3 times higher than the rate in the general population, and 40% were in need of emergency dental treatment. Yeah, so you can really see, like, really amongst the folks, and again, there's the survey. It'd be lovely if we could dive more deeply into some of the folks who really have the most need, but the surveys really do not do a great job of that. But looking at the data about the rapidly increasing costs and the other challenges, this is, if anything, only going to get worse. And so the other piece with it is how we want to talk about is just how dental coverage varies. So when we look at people who are racialized, so 39% of people who are racialized reported they didn't have access to dental insurance, compared to 28% of white residents. 50% of folks who had moved into the region moved into the country in the last 10 years, but lived in the region, so they didn't have insurance, compared to 26% of non-immigrants. So in terms of a lot of the areas where we have seen Kitchener and Waterloo Region growing, it is in populations that are particularly less likely to have lower rates of insurance. So again, speaking to those emerging trends with the rapid acceleration in the last 5 years of population growth, there's going to be even more challenges in terms of folks without insurance. Then when we split it out by age, seniors have very low dental insurance coverage. And this chart here was created before the introduction of the most recent program for seniors in Ontario, though it wouldn't make a dramatic difference just because the relatively low uptake, but it would definitely improve the percentage of seniors without insurance if we had the most recent data. But you can see both younger folks and most dramatically seniors are less likely to have insurance. Again, when you have a program that is associated with your employment, when you retire, you'll also lose your oral health benefits. We also saw particularly high rates of, low rates of dental coverage and worse oral health amongst those who reported functional difficulties. So the survey itself doesn't really dive deeply into disabilities as opposed to functional difficulties, but it really shows, I mean, people with a variety of different disability or limitations that often are strongly correlated with overall disability, had, all of them were reporting worse oral health, and many of them were reporting lower access to dental insurance programs and those without. And this chart here shows the differences across a variety of different populations, showing how many had access to reported lower to oral health. I do see, just in terms of time, I should probably start wrapping stuff up. So I'm gonna go through a couple of these things a bit quicker than I had originally intended, I think. But the most critical one is people who are food insecure and people who are low income were most likely to report that their oral health was very low, but renters were also particularly likely to note that as well. People who were children, often covered, many of whom are covered under various programs, social service program directed at children, haven't had as much time for significant oral health issues to emerge, reported the best oral health, as did higher income folks, owners, and people who identified as white. But really, in terms of, and this again, maybe given the point, this chart here, well, is a bit more detailed. It's probably a bit too much time for what we have today, but I really wanted to talk a little bit about the oral health of those who are food insecure, which, about 40% of those who said they're severely food insecure in the region reported no access to dental insurance. Almost half of those who said more moderately food insecure. In terms of food insecurity, we can see there's a lot of other challenges, particularly with a lot of this oral health challenges, is saying that people are, they also struggle with comfort of eating. So it's painful to eat. And again, this data is all going to be available in the report. But key thing, people who are food insecure are not getting proper oral health, and it's often contributing to their food insecurity because of the pain that it may take to eat, and that often leads to them eating excessively processed food, which leads to a whole bunch of other health challenges in the long run, in addition to the ones they already have. I think I'm supposed to be wrapping up now, but I do want to just say, I think a lot of people are noting, COVID has just created dramatic differences in terms of a lot of dental programs. We interviewed folks across a variety of different regions. People are saying they're operating at 10 or 15% capacity throughout the first year of the pandemic. Experts we talked to as part of a conference we had amongst a number of folks were saying that they're estimating that their services are going to be at reduced capacity indefinitely because of new rules around the cleaning for the pandemic. And then there's a whole bunch of different changes that we've seen to the labor force, as well as people's financial security, that also will make some real challenges in terms of oral health services. So I'll wrap up there. Again, a lot of things that I got through pretty quickly, all of which will be available in the full report, which will be distributed in the near future.
So thank you, Steve. I mean, wow, that's a ton of information. As Steve said, a copy of this presentation and the full report are going to be available very soon. I know for KWCF, I want to thank you for doing all of this work and for presenting these findings, because for us, it'll help us in analyzing and helping tackle the challenges that are very important in the region. So including oral health. So we really, really appreciate your work and the support of Green Shield Canada in bringing this to the community.